Welcome, I'm Barbara Marcum, the Director of Senior Resources for the City of Westland, and with me today is Cameron Elrod, and we're going to be talking about the Mission of Mercy, otherwise known as MOM, M-O-M.
That's right.
And this was really interesting because I read an article, it was in the Dental Association article, and I was like, wow, I wanted to get this information out to everybody. So let's start with what is the Mission of Mercy?
Great. It's a 2-day free clinic designed and positioned in a community that might have a need for it, where we see several thousand people and do free dentistry on them. And we set it up, tear it down, and we're in and out.
How long? I know we talked earlier before the show, and you said that they do this in every state. But in Michigan, I saw that this is the 5th one. Is that correct?
That is correct. So the organization started in Virginia in 2008, and they got it going. And then there was an independent group that thought, well, somebody's got to figure out how to build all these dental chairs, because we bring in 200 dental chairs, set them up in one day, and they all come in a big semi. And just the capital cost of that alone is so exorbitant that we all share that semi full of equipment as it travels from state to state. But each state's association does their own events and picks their own locations.
Well, who works these dental clinics? Do you have a variety of different areas of skill?
Yeah, see, the dental community has tons of people in it. It's not just dentists and hygienists and the dental assistants. There's vendors and suppliers and contractors and bankers, and there's just so many pieces to the puzzle, and everybody collaborates to put this together. So we need all of the dentists and their staff working the event, plus all the other people that do the auxiliary components of it come together to put the program on.
Well, there's a huge need for that. I mean, I know that working with seniors, some of the procedures are very expensive. A lot of people don't have dental insurance. So this clinic in Flint is from the 13th of the 8th to the 18th, and is that June?
It is June, and the 13th is the setup.
Okay.
And the 18th is the tear down. So the clinic is only operating in the 2 days in between.
Now, these aren't like you don't move into a building where everything's set up for you. They build these little...
We do. We build a 200 operatory dental clinic in the Dort Financial Center in Flint, which is a hockey arena. So we've removed everything. We set up an entire system, all of the compressors and vacuums and electricity to facilitate this. And we'll intake everybody in one of the hockey arenas, and we'll do all the clinical work in the other hockey arena.
This sounds like a huge production. I mean, huge.
Yeah, it is. It takes years of effort to kind of get good at it, and then leading up to the event, it takes an entire year of planning and coordinating.
What is the average number of people that you serve at each one of these clinics?
So our goal is to see about 1,000 patients a day. So in 2 days, we'll see 2,000 people.
When I was reading this article, it said there are something like 6,000 different procedures that they do with all these people. It's so you may see 2,000 people, but it's not 2,000 procedures you're doing. You're doing probably more than that. Somebody may need a couple of different things.
That's right. Yeah, people will come in with a whole list of things that needs to be done. Our goal is to identify their most important or most urgent need and get that done. And if time permits, or if they're in the right spot at the right time in the building, we'll do more. And then if they've got time to spend, they can always get back in line and get another procedure done if it happens to be in another department.
I also read in this article that it was midnight of the night before the clinic that people start lining up.
Yeah, it's true. It's not, we might get 100 people there that have something that they desperately need to get done. And so they're not going to take any chances. They're going to get in line and make sure that they get seen. You don't have to come in at midnight and get in line.
But first come, first serve, I assume.
Right.
There's no appointment.
It is first come, first serve, and and no appointment is necessary. But if you get there in the morning, you're going to get taken care of and seen that day. My job at the event is to actually work that line and manage the outside. So I get there at 3 o'clock in the morning and interact with all of the patients that are waiting.
Plenty of coffee that day.
plenty of coffee that day, right?
Okay, so I understand that there's an evaluation first. So as you see people, you evaluate them for their most urgent need. If they have other things and you don't get to them, do later on they let them know places that they can go or things to get the rest of.
Right. So everybody will leave with a contact of a clinic that can help them be their dental home. There's free and low fee resources within the community, and we'll make sure that they're directed to them.
What kind of procedures do they do? I mean, I'm sure, do they do extractions? What kind of things do they do there other than a filling or?
Yeah, we do a majority of dentistry. There's certain things, it's easier to say the things we don't do. So
Okay.
we don't do orthodontics,
Right.
that takes 6 months to 2 years. So we don't do that. We're not placing implants. And we're not building dentures on site. If you're in the community and have already made contact with the mom event, there is going to be a certain group where we're going to make dentures, but we're pre-making them and only delivering them at the event. Otherwise, we're doing like crowns, fillings, extractions, hygiene cleanings.
No cosmetic things either, right? So no implants, no.
We're not doing implants. However, for those, if somebody's missing a tooth in their smile,
Right.
there's that's a big thing. And there is a lab, there's several labs actually, but there's a whole group of people that have volunteered their time to come in and make some removable components so you could fill that gap with a tooth. But there's a very small amount that we can actually get done in 2 days.
Yeah.
And so they'll go through the line, identify the people who they could actually do it on, and they'll do their best to make them and have them leave with that space filled.
Yeah, it makes a difference.
Yeah,
it
certainly.
sure does. Okay, so who qualifies for this event? I mean, for anybody can go. I mean, you want people obviously who are needy, who don't have insurance, right?
Well,
Or does age make a difference either, or no?
it doesn't. Actually, everyone is qualified. We want people who have a need
Yeah.
to be this opportunity to get that need met. If you have insurance and you have a job and you have the resources to go to your local dentist, then you should go to your local dentist.
Yeah, exactly.
But there are a tremendous amount of people that have insurance that still, because all insurances aren't the same.
No, they're not.
So some insurances are just worthless. They don't add any value at all. They're just a coupon or a discount program. And so your out-of-pocket cost still can be enormous.
Yes.
To get the work done. And sometimes they force you to places you don't, it's not an ideal place to navigate. And so if you're stuck where maybe you have an income and you don't qualify for a state program, or maybe you have, you're underinsured, let's call it,
Yes.
You're welcome to come. There's lots of people with jobs and good insurance that still don't have the resources to get the work done because they're still responsible for half of the cost, and it's still too much.
Yes.
So if you find yourself in that position, this is a good event for you.
Oh, that is great to know.
Yeah.
When people go and you see them and do an evaluation, what kind of documentation do they have to have? Anything? Do you want to see something? Identity, who they are, anything?
We don't ask for anything. And anybody who shows up, we're going to treat them. So now the one thing that we want them to do though is we want them to know their medications.
Oh yeah.
Right? So you can't show up and not know what medications you're on because they might...
Blood thinners, all those things.
They might turn you away if
Yeah.
you can't tell them that. And then if we start treatment and you're on blood thinners and we're doing an extraction, it's a mess for everybody.
I was going to say a problem for everyone involved.
Right.
Yeah, absolutely. Okay, so I also read in there, and I was thinking about this as well. Not only do you have to have your medications, if you have a heart problem or some kind of medical issue where a procedure may be dangerous for you, is it important that you know that?
Absolutely. We need to know. When we intake a patient, the only thing we're going to take the name and an address so we can track where services are going. We're trying to measure that. But from there, we just need to know the medications that you're on, any things, any health issues that would
Medical
prevent you.
screening type thing.
Right.
Yeah.
It's a basic medical screening so that the dentist that's doing kind of the triage of the patient knows what they have the capacity of doing with them.
Okay, so after the evaluation, what happens next?
Sure. So patient comes in, we're going to do patient education. So a lot of times the reason why people get themselves in a position where their oral health is degraded is because they're not doing basic hygiene at the level that they should. And quite often people just have never been told, have never been educated. They don't know the science behind it. And we're going to have this entire team of people teaching them how to properly do this so that they can make good decisions and take good care of themselves. So maybe they don't even need us 2 years later when we come back.
Yeah,
right?
do you find that a lot, that people just over the years or something, especially you and I were talking about that, as people get older, your teeth, your permanent teeth, we don't have like sharks where they fall out and we get new ones. So after living a whole life, most people drank a lot of coffee and ate lots of acidic things.
Right.
So you're going to see the teeth degrade over time as well. So you do see seniors too. You said anybody, any age?
All ages.
Okay.
Right. We have lots of seniors that come to the event.
Yeah.
If you come to the event and you have mobility issues, you want to make sure that you bring a chair to sit in, because it's a long line.
Yeah.
And sometimes it's moving quick, sometimes it moves dreadfully slow. And right before you get to the front of the line, they'll ask you to take your chairs and put them in your car because you can't bring them into the clinic. But there's no mobility problems at the facility. There's no steps. There's no, you walk straight through. So it's a pretty easy transition for somebody who's senior.
So you don't turn away anyone unless it is an issue with medication or a physical or medical issue.
Exactly.
Okay.
Everyone's welcome.
Okay, so what are the different areas of treatment? Okay, so you said you had an area where they teach them about hygiene.
Yeah.
What are the other areas that are set up in the clinic?
Yeah, so we'll bring them through hygiene, then we'll do the triage. So triage is basically a dentist they're going to do x-rays and they're going to look in your mouth and they're going to determine what's going on and make a list of recommendations of what needs. And then they'll kind of force rank them. And then the goal is to get you into the segment that will treat your number one need. And so those could range from, maybe you have a broken tooth that's salvageable and we need to repair it, or it's got just disease like decay in it. And so we'll send you to the restorative department, which is just the tooth fixing department.
Right.
And they'll either put like a filling material in it, and in some cases we'll actually do crowns, which is unheard of in maybe the low fee or free dentistry world.
Yes.
But the dentists in the community are bringing their equipment. There's these CAD/CAM machines that they can actually digitally scan the tooth and then mill out a crown to go on the patient's prepped tooth. And so they're getting actually very high-end work done.
Right.
Because these are all they're all dentists that are working in the community. They have their own dental offices all over the state, and then they just close their office and come do it in the clinic for 2 days here. So they're doing the same type of work they would at their other facility. Now, because of the amount of time it takes to do that, we're going to be limited on that quantity, but that's just an example of some of the things that we'll be doing. We'll have a oral surgery department where we'll have a bunch of oral surgeons there. So we're extracting teeth. So if a tooth is infected and not salvageable, then we'll remove the tooth. But we won't do like wisdom teeth that are fully impacted and there's no infection. We're just not set up for that type of full sedation type.
Oh, yeah, for sure.
Right.
I was thinking too, like people with an abscess or, things like that. I mean, do they handle those as if it's with the tooth, if it needs extracted? Do they?
That's probably our most common procedure, because if somebody's in pain, oftentimes they have an abscess, and we'll even be doing some root canals if the tooth is salvageable and there's an infection. We'll be doing root canal therapy, but a lot of times there's just an infection that needs to be dealt with. It's causing the pain.
Well, I was looking at all these categories in endodontics. What is that?
That's root canal therapy. So
Okay.
if you need a root canal, that's done by an endodontist.
Okay.
And they're doing little microscopic surgery on the tooth, going down in the canal and pulling the infected root out and filling it.
This is like amazing me because, okay, so I know a lot of the people that I've dealt with over the years at the senior center without insurance go to a county health clinic, and there are students there that are supervised by a
Right.
dentist, but they're still doing the work. A couple of times it's been a real nightmare, I'll be honest with you. But these are not people who are students. They are fully licensed professionals.
That's correct.
Okay.
And almost all of them are running very successful dental practices somewhere in the state of Michigan, and they come in to do work here for 2 days.
Okay, so you have this long line, you do the triage, you get people going where they're supposed to go. Do you take breaks? I mean, do you stop at, like, you open the clinic at what time?
I believe the clinic's opening at 8 o'clock in the morning.
Okay, then
we'll
when does
start
it close?
intaking people.
Yeah.
We'll close around 5.
Okay.
And sometimes we run late because we're trying to get people who are, halfway through it finished.
Right.
And so everybody sticks around to finish. But there's no breaks. The clinic just runs continuously. The staff that's working the event runs in cycles and breaks, and they start rotating through. So nobody's
Yeah.
working a 12-hour day.
Well, I mean, you still have to be exhausted, being on your feet all day long and, taking care of various people. I mean, it's got to be very taxing. So, I mean, this is a great thing, I think, I was reading that people can do their whole dental team. It's a really good team building thing. It's also great to network with dentists around the state. Do you have anybody coming from out of state, or are they basically all Michigan professionals?
We do get out-of-staters that
Okay.
have just fallen in love with the program, and they'll travel to go see to go work these programs. But most of them are Michigan professionals that participate.
Okay, do you often have the same people over again, or do you try to get the word out to get some newcomers in there as well?
It's generally newcomers because we've done this in Saginaw, we've done it in Big Rapids,
Yep.
we've done it in Grand Rapids, we've done
Macomb
it
County.
over in Macomb County. And so there are a few people that have figured out the program and they show up each year,
Okay.
which is fine. They're welcome to. But majority of the people that are there are from that community.
In this article, I was reading that you delivered between $885,000 to more than $1 million of free dental services. Is this per clinic?
It is. Yeah,
Wow.
so if we just take the retail value of those procedures done back in the office of the dentist that's doing the work, and we just add it all up, we'll do over $1 million worth of dentistry in 2 days.
What a gift. I mean,
Yeah.
really, for people who can't afford it. I mean, a lot of people don't realize when they have had good dental care and they've had access to dental services all their lives, they don't understand the importance of your mouth. You know what I mean? It's like, it's very important that it stays in good, healthy condition. It can lead to other medical issues, you know what I mean?
And
As far
mental
as
issues.
Yes, infection, and it also, you think about your self-image and how you present yourself to other people. It's very important that, people have access to that if they're not insured or can't afford it.
Sure. I mean, just getting a job or getting a date is difficult if you have a major infection going on in your mouth
Yes.
or missing teeth.
Yeah.
But certainly, dentistry is directly tied to the rest of the body. So, like you said, mental health, but it's true. Like, there's a tie between periodontal disease and Alzheimer's disease. There's a tie between periodontal disease and heart disease. You can't get major surgery without them sending you back to your dentist to make sure you don't have periodontal disease.
Oh, you are right. You know what? I actually didn't know that. I just
Yeah.
found that out. Oh, it was several weeks ago, but it was like, I had to go to the dentist before they would do this heart surgery. And it was like, really?
Yeah, and if you have an infection, and people misunderstand it, if you're brushing or flossing at all and there's any blood, you have an infection. So you're not supposed to bleed at all. And maybe 50, 60% of the population has some level of periodontal disease, and they're swallowing that infection all day, and it has serious implications to your long-term health.
Yeah, yeah. For me, it's like in different areas, like I help people on a daily basis, and it's very rewarding for me. But like as a dentist, and you see people, and normally in an office, you see people who are insured, it's got to be really rewarding to be able to use your skills to go out and help people who otherwise wouldn't get the help.
It is super rewarding. When you see this group of probably 1,700 volunteers that just come back every time we do the program, they come back and volunteer, because it's extremely rewarding, to see people, getting what they need, because they're struggling to get these needs met on their own. There's just not the resources out there for them, or they don't personally have the resources, and you can deliver it all in one day. It's very satisfying.
So how do you go about do you put the word out to dental offices? How do you get people to become engaged with this program, and each different time, how far in advance do you have to say, this is what we're doing, this is where because they got to clear their schedules as well.
Right. Yeah, they got to close their offices, clear their schedules and all that stuff. So it's actually pretty easy for the dental community because they're aware of it, and it's majority the same volunteers each time, and so there's a lot of repeat volunteers. It's the rest of the event, it's another 700-800 people that we need to just be patient advocates and walk with them, and if somebody's elderly or less mobile, stay with them and help them through. We need interpreters, we need physical labor to help us set up and tear down and load these semis back up with all 200 dental chairs, and disassemble this entire deal. It takes a lot of people. So that's probably the hardest part, because they're geographically, centric. And so that whole crew is a different crew every event.
Right.
And so finding those people is generally the toughest part.
Well, okay, so you just said interpreters, and I'm thinking oral surgeons, dental hygienists, and dentists, and blah, 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 but you need a lot of other people as well. Do you put anything out there so that people who are not in the dental profession can find a place with you? We
try, but there's not a lot of good resources for it. Like this is a great resource, so thanks for letting me talk about it.
My pleasure to bring the information out, really, yeah.
But it's, generally it's word of mouth through the dental community, reaching out to the non-clinicians in the community. So like we were saying earlier, when at this event, I'll be looking around, I'll recognize so many people there because they're not dentists, but maybe they are a bank and their team that specializes in lending to dental offices, or it's a contractor who builds dental offices and all his subs and their families are there. So there's just a lot of people that are in the industry that reach out to their extended families and stuff and come in and help.
Wow. Okay, I know this. I was thinking about this as well. Okay, so you have all of these people from all of these different areas. So if they bring their team in, do they actually work together with their team? Because if, once you get into a routine at a dental office, okay, your staff works together, we know each other, how we do things, blah, blah, blah. And then when you're working with people that you've never worked with, is that ever a problem, or do people just slide right into the role and go for it?
So we let them work together. So if you show up with your dental assistant, you're paired together and you work together.
Okay.
But most dental professionals are real pros. Like they can adapt to just about anything. And so it's really, from the dentist perspective, if they feel adaptable, they won't have a problem. And if they aren't, they'll make sure they bring their assistant.
Well, what happened with COVID? Like, were you doing this like every year? And certainly then COVID would have impacted that year or the year before or the year after?
Yeah, so we started in Michigan in 2013 or 14. And then the goal was to do it every other year. And because it just takes 2 years to build the resources up and to put it on.
Right.
And so then we were going to be doing it at the Flint Dort Financial Hockey Arena in June of 2020, and then COVID hit and shut the whole event down. And because of COVID, we had to take a break
Now, had you planned this and gone through all the planning process, and then boom,
Yep.
it was done?
It was all ready to go.
Oh, that must have been heartbreaking.
It was. And then there were so many vendors that were so helpful in protecting us and not losing our dollars, you know, so they let us roll it into the next one. So it all worked out. So here we are in 2024, and our next one we'll plan on 2026.
Well, I just wanted to let you know that you can always look at Westland. Westland is an area, a surrounding area too, where many people are needing of that. But I'd love to have you on maybe after this event again, and we'll talk about that. It's just something I think we need. I didn't know about this, and I know about a lot of things that go on that assist people who are needy. So the fact that I wasn't aware that these were even happening. It's like, I'd love to have you on again after you're done in June, and then we can talk about the next one, so people are well aware and can plan to be there, because I think this is wonderful. And
yeah, thank you.
I thank you, Cameron.
I'd be happy to join you.
Okay, wonderful. Thank you so much.
You're welcome. Thanks for having me on.
Oh, thank you for being here. And thank you and the viewing audience for being with us today. I'm Barbara Marcum, and this is Friendship Focus.